Good evening, everyone. Time to our Ognon class. So, we are on the voyage, and I told you before starting the this dynamic concept that there is a turbulence in this phase of voyage. Turbulence, I meant that the the topic we are studying it is it is a topic which is yet to be yet to be start in the mainstream medicine. But in homeopathy is already there. Turbulence in the sense that we are trying to understand latest, but the language is quite ancient. Turbulence in the sense that we are trying to understand, but then our parameters to understand are substandard. So the turbulence is not due to anything else. Turbulence is only due to our limitations. Our limitations in understanding the forwardness of Master Hangman. He was much ahead from his time, even rather much ahead from our time. And still we are trying to judge Hangman's concept, especially this dynamic concept, even from today's parameters. But then still those parameters are still on anvil, still not made. And that is the reason we put ourselves in the turbulence. The best way will be to understand Hahnemann that whatever the words are used by Master Hahnemann here, whatever the words used by Master Hahnemann here, we have to try to understand their meaning as per his time. But then we need to understand that how far he is talking. And he is so advanced in expressing his view as the dynamic concept that even today the medicine has not reached to that level. So for last some 4 or 5 classes, we devoted a enough good time to really understand, and I tried to convey in my very poor knowledge of this topic. At least there is some ground to stand to seek further knowledge of this topic. Until and unless we really be a seeker towards this topic of dynamicity, we will not be able to grasp it. And for sure, the way we are trained in a very, very materialistic way, our reason, our mind will not really allow us to accept it. So my view is that be a seeker, try to be very, very submissive and seek this topic of understanding of dynamicity. We may reach somewhere. So far, we discussed how to understand the concept of vital force, for which I gave you the understanding from the school time, that is by knowing living and non-living difference, 7 characteristics of living. Then I spoke to you about the complete lineage of the concept of vital force from the ancient time, that is from Vedas to the Sankhya philosophy to the Greek philosophy to the Western philosophy, and ultimately I took you to the point that in some recent past, only some 200-300 years before, some of the people, those who made the life materialistic to make it certain, that is Rene Descartes and allies, the understanding of the concept of vital force was kept aside. But then in the medicine, Dr. Henneman revived it right in the early 19th century, and in the further time in the 20th century and all, there were so many those who developed this concept again, and now it is keeping standing firm that this concept has to be undertaken if you want to study this. And I gave you the reference regarding the second preface of the Organon by the author, where he said that we should be having our own principles to define and understand the life and its problems and its solutions. So, like this, we went further to understand the concept of health on the basis of this concept of vital force, the dynamic concept. We learned the characteristics of the vital force, and then we learned that what is the difference between the living and non-living as per aphorism 11, as per aphorism 10 in the Organon of Medicine. 9 tells us about the health, the dynamic concept of the health. 10th of the aphorism tells us the adynamic state called death, where three things. One, the sensations, that is pertaining to the senses. Second, related to the functions. And third is self-preservation. I told you recently we can understand this concept by going into the concept of homeostasis. In the homeostasis, there are some 4 or 5 points which you all should keep in mind. One, that what all in totality the meaning of homeostasis is maintaining the equilibrium of the internal environment despite whatever may be the outside environment. The whole organism under the complete coverage of vital force, control of vital force, keeps the internal environment in a great state of equilibrium, whatever may be the state in its surrounding. Maintaining the equilibrium in what way? The one thing what we read is acid fast balance, that is to maintain the pH of the blood. Then you the body temperature, then blood glucose level, then third is calcium level in the blood, in the serum, and the fluid volume. These are the some very, very important point, and one more, oxygen concentration. And the best thing is that it has got a range. Somewhere it is a very narrow range, and at some places it is some little more range. Like for example, we take oxygen. Our oxygen level remains between somewhere SpO2 level is somewhere above 94 to 100% in the blood. Below 94, it shows the signs of breathlessness. But if you see it clinically, without oxygen, it is 3 minutes. Thereafter, this 3 minutes is a very, very critical time. If in this time this airway is not established, it may cause quite a big damage, especially to the nervous system. Similarly, if somebody is not really getting water, it is 3 days. Without a drop of water, somebody can survive, maintain this homeostasis, maintain this equilibrium inside. Or it may take 3 weeks if no food is supplied from the outside. So you can say Formula 3, we can see to understand the range. The range is for oxygen. Range is for acid phos balance, means pH is slightly alkaline 7.04, a slight shift in some point something something, and it causes death. Yes, blood glucose, yes, quite a big range it has. But then if you go below 60, it is a danger. Similarly, calcium level in the fluid. If the calcium level goes below 7.6, it causes tetany. Like this, every substance has a range. Like fluid balance. If fluid balance is not maintained, if suppose that fluid balance is not, that fluid volume is not that much, that it is not able to exert a pressure up to 60 mmHg, it is going to fail the kidneys. So my point is to understand this self-preservation, this equilibrium, this homeostasis inside, despite whatever is the surrounding outside, is a very, very important function which vital force plays. Three things: sensations means related to the senses, functions means related to the systems, and all these systems work in such a way that it maintains the equilibrium, the homeostasis, the self-preservation. And if all these three major events are absent, it means the state is adynamic of that person, and the person is no more, only the body is present. That is a dead body. Now, let us know about the aphorism 11, the disease. How to understand the dynamic concept of disease. This is something very, very important. And in this aphorism 11, especially in the sixth edition of the Ordnung, Henman has given a very long footnote to explain something about the dynamicity. This we are going to explain something about the dynamicity. This we are going to understand along with the aphorism. So let us start with the aphorism 11. The aphorism 11 is, when a person falls ill, it is only this spiritual, self-acting, automatic vital force everywhere present in his organism that is primarily arranged by the dynamic influence upon it of a morbific agent inimical to life. It is only the vital force deranged to such an abnormal state that can furnish the organism with its disagreeable sensations and incline it to the irregular processes which we call disease. See, this is the dynamic definition of the disease as what is that? I read only that definition. It is only the vital force deranged to such an extent, to such an abnormal state that can furnish the organism with its disagreeable sensations and incline it to the irregular processes which we call disease. So, as we understood the health, and we understood the health as a dynamic disease, sorry, we understood the health as a dynamic dynamic concept of health. It is not a state. We have to understand on that basis that disease is also that way dynamic. So when we say dynamic means in a state of health, the situation of health is somewhat like a wave. It is just like this going up, going down, because all the time some of the surroundings, in everybody's surrounding, there are circumstances, there are situations, there are issues, there are agents, those who are capable of influencing badly on this wave of health. And this vital force keeps maintaining this by their virtue of self preservation. Then does not mean that it is so static. No, sometimes it is going somewhat down. As I told you, the wave. When wave is sometime almost touching the baseline, but does not go below the baseline. Below the baseline is a disease. Why I'm saying all this? To understand the very word written here, to such an abnormal state. The outside morbific agents means those agents, those circumstances which has a capacity to dent the health, the wave of the health. And that is why it is sometime going down to the baseline, then again vital force is capable to maintain it. But sometime some such circumstances occurs in such a way that it just go below the baseline. That going below the baseline and knowing that how it has gone below the baseline is such extent, is such an abnormal state, then only it is going to be the disease, the dynamic disease. It happens sometime, for example, somebody exposed to this severe scorching heat, but then coming back, having lot of water and be in a cool place and some 2-3 hours, you regain health. That is what some this this scorching heat is a example, one of the examples of the morbific agent. Morbific means something which is capable of causing the disease. Some agent, some circumstance which has a capability to put your wave of the health below the baseline. But then there should be some extent to that. Until otherwise it is going below the baseline, it will not form a disease. So the very basic definition about the dynamic disease is it is only the vital force deranged to such an abnormal state that can furnish the organism with its disagreeable sensations and incline it to the irregular processes which we call disease. What is this disagreeable sensations? When your senses, all those 5 senses, find some unusual awareness about the understanding of it. Like you are not able to tolerate the light of your tube light or the bulb or whatever the light you sit in, usually well tolerated. But after exposing to the scorching heat, you're coming back and you are unable to tolerate this light at all. Your vision, your eyes become so sensitive and it causes pain. You just cannot open this light, whatever may be the work. Similarly, you are unable to tolerate the noise of the fan in which you have been sitting for so many years. Today, you cannot. These are disagreeable sensations. Your bed on which you have been sleeping for months together, now you feel very hard. These are all examples of disagreeable sensations. And what is this? Incline it to the irregular processes. That is the mess of the functions of the systems. When the functions of the systems go haywire, when systems functions go into the disharmony, is called irregular processes. Processes means functions, and irregular means they lost their harmony. They became from regular to irregular. So two things affected: one, the sensations, the second is the functions. And when these two things are affected, definitely there is some disturbance in the homeostasis. But then that disturbance will not cease. Somehow body will maintain the pH, body will maintain the volume. Somewhere it is disturbing the range. Like for example, body temperature goes very high, but then it is not going that high that life stop living, means life ceases. It is not going that high. So that is why three things have been talking in the aphorism 10 regarding defining death. One, sensation, function, self-preservation. But when you define illness, in the illness, this self-preservation here, Henman, is not written. Reason being, because somehow with the altered sensations and the functions, the preservation is there, though also it is affected, but then it's not going beyond that range that life seizes itself. That is why Henman did not mention the self-preservation. Means the temperature range disturbs. pH range may disturb to some extent. But then it has to be somewhere within the range where it can go up or down. So it is the mainly disturbance of sensations and the functions. And first of all, we need to see this disturbance with the vital force. Let us start it once again. When a person falls ill, it is only the spiritual self-acting, that means automatic vital force present where? Where is that's a very important question that been asked in the class. Where is this vital force present? Such a clearly he has mentioned, everywhere present in his organism. It is present everywhere. Like all our cells, and in all cells, living cells, the constant exchange from the membrane is going on. The sodium potassium pump is on in every cell. Who is maintaining this sodium potassium pump? Who is maintaining this equilibrium of each cell? It is the vital force. That is why he says present where? Present everywhere in the organism. That is primarily deranged. That gets deranged first of all. How? Similarly, like some energies. What kind of energies? Which are dynamic. morbific agents. There are morbific agents inimical to life. I am saying, what are those morbific agents? When we say morbific means that something morbid. When you try to understand the word morbid, then the morbid means something pertaining to the death. That means those circumstances, those situations which are having the capacity to stop the function of homeostasis, to stop the function of self preservation of the organism, of the cell. That is the situation or the circumstances named as morbific agent. And all these morbific agents are also in the form of some kind or the other kind of energies. So they again have what? Dynamic influence. They influence us dynamically. What do you mean by dynamic? Dynamic means a something constantly changing situation. Constantly changing situation is dynamic. And what do you mean by influence? Influence means when, like, if suppose you, while taking bath, when you are under the shower and the water is showering on you, that means you are influencing yourself with the water. This is the meaning of influence. You almost get merged into that energy. That is what the meaning of influence. So if we try to again put all these meanings together and try to understand this line again, when a person falls ill, it is only this spiritual means something which is immaterial. We learned it further earlier. Self-acting, which is a power generated by its own power, hence it is self-acting. That means automatic, vital force everywhere present in the organism gets deranged primarily by the dynamic influence upon it of a morbific agent inimical to life. It is only the vital force deranged to such an abnormal state that it can furnish the organism with its disagreeable sensations and inclination to it, the irregular processes which we call disease. For as a power invisible to in itself and only cognizable by its effects on the organism. Now again he is coming to explain about the vital force. What is that power? For as a power, vital power, that vital force, invisible in itself. We discussed earlier. What is this power? It is invisible itself, like the air, like any other energy. It is invisible, means you cannot perceive it with your senses. But you can only cognize it by the effects on the organism. All those energies, especially this vital energy, cannot be seen by the senses of yours, but then you can perceive, you can see, or you can sense the effects of it. For example, I'm talking to you. You can very easily say, yes, this is the expression, this is the sign, this is the uh, cognizable expression of the vital force exists in me. Because my voice, you can listen with your senses. Virtually, though, but you are able to see me. If you're able to see me and you're able to see me moving, talking, saying something, expressing something. This expression of your seeing, vision, is nothing but the expression of vital force within me. So we talked it earlier. He is mentioning here what Hahnemann has done. He did not write anything on the concept of vital force. Rather, he simply explained the concept of vital force while telling the understanding of dynamic concept of health, dynamic concept of illness, and then further he is going to teach us the dynamic concept of cure. And in between, he taught in Aphorism 10 about the a-dynamic concept that is called death. And in doing this, he in between gave us the understanding of concept of vital force. This is now, though we discussed earlier, but here we find it in the Aphorism 11 that the vital force is one such power cannot be perceived by your senses, but you can perceive the effects of the vital force by your senses. This is what actually he wants to say. Listen again. For as a power invisible in itself and only cognizable by its effects on the organism, its morbid derangements only makes it self-known by the manifestation of disease in the sensations and functions of those parts of the organism exposed to the senses of the observer and physician, that is, by morbid symptom, and in no other way can it make known itself known. So, why he explained the concept of vital force here, saying that the vital force cannot be perceived by senses, only by the effects of it, to make us understand that when there is a disease, that means the alteration, the deviation of the derangement of the vital force, we cannot sense it, we cannot see or hear this derangement of the vital force because we can't see, we can't sense vital force directly. But then definitely it will be showing the effects. What are the effects? Effects in the form of altered sensations and altered functions. That is what we call as morbid symptoms. All those symptoms which are indicating towards the seemingly, possibly a situation towards the death. Somebody having a fever more than 104, he immediately rushed to the hospital or to the doctor, keeping in view something untoward may occur. That means that this vital force may break the union with the body. So he says here in this aphorism that disease means alteration of the vital force, which can be only perceived by the altered functions and the sensations, and of the vital force, which can be only perceived by the altered functions and the sensations. And as you cannot see the vital force directly, you cannot see this derangement directly. Even if you go inside, whatever the extent you go inside, you can't see that derangement of the vital force exactly. So there is only one way to understand the derangement of vital force, that is by morbid symptoms. This is the whole understanding. We are to simplify this aphorism in this way, that there are certain characteristics here. Again, he is talking regarding the vital force. Once we understood the characteristics of the vital force, then comes exactly to understand the definition of the dynamic disease. Dynamic disease means it is the derangement of the vital force to such an extent, to such an abnormal state, that it must finally give some kind of alterations of sensations and the functions. Then only it can be called as disease. And very, very simply, we are to understand it is the dynamic influences of morbific agents, which is only going to derange the vital force, nothing else. So, keeping this in mind, we have to understand when seeing a patient, when seeing a disease, we are to look into the dynamic influences of morbific agents. And we have to see what are those altered sensation and functions as symptoms. And we have to be very sure to understand that symptoms are the sole guide to understand this derangement, and that is going to teach us what and how to support health this organism, this ill organism. Let us take some examples. One example nowadays, what is happening? This COVID-19 is a story all around the world. And you see, we are finding such messages. And I came across personally to some of the cases where they came up with the report that one patient, she's a case of CA breast cancer. She will be getting herself treated with the Apollo hospital. So it is always the right of the patient to go. Though after she was told so many understanding, but then it is the right of the patient. They chose that way. And now, in almost for every such compromised patient, the private hospitals have got a norm that they will be getting their COVID-19 RT-PCR test, whether it is positive or negative. Then they were very alarmed and called me that our test was done positive or negative. Then they were very alarmed and called me that our test was done regarding this COVID-19 and it came positive. And when I tried to understand what are the complaints and situations with the patient, as such, there was nothing wrong with the patient. And I don't believe there are asymptomatic patients. They call asymptomatic where the classical features are not there. But I believe that it is not that way. The alteration of the health, it can be anything. But as such, patient was not having sudden any kind, and they got the result end of the day, and it is negative. You imagine the ordeal. What I am going to make a point here is that confirming the disease by the test only is a folly. Whatever may be the accuracy, there is always an error of the test. And what we are finding regarding the error for the COVID-19 is quite a big range, maybe something more than 50-20%, because of the problems with the kit, maybe some other problems while performing the test. There are so many issues, and human is in error. So yes, it can happen. I'm not blaming that way. I'm saying as a doctor, when Henman says, I am going to appreciate before you, and I to myself agree that it is the best wisdom to be very careful finding out the alterations of the sensations and the functions. And you will get, yes, there are certain alterations with this person. And instead of really going into, if patient desire, let him go. But as a doctor, as a homeopathic doctor, let us see what is that alteration. Try to understand with the symptoms, and with that symptoms totality, if we just come to know what is the indicated remedy, the patient will all right within some 1 or 2, 3 days. I am not only experiencing, all of you treating your patients maybe with the seasonal of diseases of cold, coryza, so many seasonal fevers are also going on. You and me don't know exactly whether you're treating exactly the COVID-19 or you're treating something like COVID-19. We cannot decide that. But one thing we can decide, yes, we saw the patient, we were able to find out the totality, gave medicine, patient became all right in a day or 2 or 3. That's it. And he is also very happy, and doctor is also very happy that patient is all right. So my point is that appreciating Hahnemann to understand things practically at the bedside and treat then and there. Be the patient all right. Go to his work. Do something for his family and for his country. What else than this? The most practical bedside learning about the disease and its treatment. It is beyond understanding regarding the treatment that patients in the world dying, we are searching for the treatment. So far, it is not viewed. The only salutary treatment is the vaccination, the so-called vaccination, they say. When it will come, the standard time is 18 months. What is going to happen in these 18 months, we don't know. But somehow, we only can help patients. Let patient get this wisdom that anything wrong with them, they just to seek homeopathy, and God let us give us this wisdom. We understand the disease of the patient by the bedside wisdom, that is by symptoms, and treat them with their totality, with the indicated medicine, and then let us give them a relief so that they must be away from this fear and disease both. So the whole thing of this understanding of aphorism 11 is regarding the understanding of dynamic definition of the illness. Definition of the illness. The dynamic definition of the illness is that you will be knowing exactly the derangement of the vital force. When somebody is suffering with say coryza, running nose, not that nose is sick. It means we always have to view as a home doctor that this running nose, this sneezing, this obstruction of the nose, this cough, this fever, this breathing difficulty, this the changes in the functions of the lungs and whatever it is happening as patient is expressing in the form of severe cough or whatever may be, nothing but the derangement of the vital force. And the vital force derangement expressed through the nose, expressed through the lungs. It is not that lung is sick. It is not that respiratory system is sick. It is not that nose is sick. It is not that GIT is sick, so he is vomiting. No. It is the expression of the derangement of the vital force. Vital force got deranged and expressing itself through the nose in the form of running nose, expressing the derangement of the vital force through the lungs in the form of coughing. This is what should be the understanding. If we keep this understanding, we are understanding the dynamicity of the disease. We are not going to miss that dynamic understanding of the disease. This is something very, very important to learn. But then we somehow get stuck with the nose. The nose is sick. And let me go to the therapeutics and find out of the therapeutics that what is the medicine for the coryza. I'm not saying that therapeutics are wrong, but then somehow when we lost the understanding of the organon, then we somehow misunderstand therapeutics. The concept of therapeutics is only to understand exactly that there are some probable remedies to be thought of. But then does not mean give it out of these 5 medicines. No, it can be different. But mostly these medicines are to be thought of first. And you can always overrule with the indications coming up, history of the patient coming up. So stop going into the mirage of the disease expressed by the part who is expressing vital force, expressing its derangement. Don't simply be in the mirage that nose is sick. Don't simply be in mirage that lungs are sick, and look for the medicines which are influencing the lung, the seat of action. I'm not saying that don't see seek of this seat of action. I am saying first try to understand it is the derangement. And this derangement of the vital force, here vital force chose that I will be expressing this derangement through the lungs, and in some of the cases, even in COVID-19, expressing through the GIT in cases of children. It is not that classical picture as we generally are listening. No, it is altogether different in the cases of children. So, like this, we are that understanding of the disease as dynamic disease. We have to keep in mind the understanding of the dynamic health, the understanding of the concept of vital force. And this concept of vital force teaches us that this vital force, a force which cannot be sensed directly, only indirectly, means by the effects only. All such energies, all such forces are that way only. Whether you learn forces or energies in the physics or in the chemistry, you know them by their effects. But there is a change happening. That the understanding up to this time when Hahnemann was writing all this, they were working on the understanding of the energies and all kind of dynamic things. Here the question is not that we only understand is not that we only understand dynamic, then they don't understand dynamic. No, it's altogether different. The only problem is with us regarding the power, regarding the dynamicity, regarding the influence of the dynamic agents. The problem is with us. They have gone very far in understanding of the dynamicity. They have gone very far understanding powers. It is only we are unnecessarily struggling to learn that show us. They are also not saying show the power just by the direct display of it to the senses. No, they understand it very well. All the powers can be expressed and understood by their effects only. But the best thing is they have not only simply understood, they have found out the ways and means of understanding the effects of the given power they want to understand. One, they have understood this. Secondly, they have gone further far in understanding that effect, that they are able to measure those effects. Let's take an example, like the magnetic power. In physics, we learn electromagnetic field. In the understanding of the electromagnetic field, they have gone so far that they have the measurement units of the effects of it. What is this electromagnetic field? The electromagnetic field means the effect of the magnet. Magnet has got a power, some kind of effect, that some of the iron things get attracted. And suppose if you simply put something fixed, some iron thing you fix somewhere and put some magnets around, that iron piece which is fixed that place cannot move, gets magnetic by the influence. That is called the dynamic influence of the magnets, and they call this dynamic influence of the magnet as electromagnetic field. And they are able to measure it. They have a unit of it. It's classes. I mean to say that they are gone much far. What Hahnemann is talking now in this time, Hahnemann talked something up to his time. The uniqueness of Hahnemann is that Hahnemann is talking all this in the art of medicine, in respect of understanding disease, in respect of understanding health, in respect of understanding cure we will be reading further. But then this dynamic power, understanding of dynamic power, is not that we only understand. Rest of the science, they understand much more than us. And not that simply they have understood how to measure it. They have all those gadgets to measure, maintain, and everything. So much so that the understanding of this dynamic power, they utilized this very knowledge of the dynamic power towards the understanding of materialistic cause of the disease. They are trying to understand the usage of this dynamic power to understand the materialistic cause of the disease. Let's take an example. We see patients MRI. What is this MRI? What is this ultrasound? These are all the usage of the dynamic powers, and they are able to read. See, they are able to read the tumors, stones, all those different kind of lumps and swellings and ulcers and everything. What is this? It is the usage of the dynamic power in the medical field. What is this nuclear medicine? What are they doing in nuclear medicine? In the nuclear medicine, they are using the dynamic powers to learn about the disease. They are using all these powers to know about the knowledge of disease. But their knowledge of disease so far still towards the materialistic point of view. Hahnemann is saying that change it and use this understanding in a very, very dynamic manner, in a very, very immaterial manner, in that way, which is still they are not making a paradigm shift. It is not a paradigm shift. That is where the problem is. In this very, very olden time, in the early 19th century, Hahnemann is talking and viewing, and he did the paradigm shift in the medical art. And we are not really understanding Hahnemann, this paradigm shift. Understanding health as dynamic concept is a paradigm shift. Why I'm going to say paradigm shift? That somewhere in the very, very early ancient time, things were understood dynamically. But then time changed and things really gone worse and towards the bad understanding. Whatever may be the reasons, we understand that. And we deflected and we just came back towards the materialistic understanding. When I say paradigm shift means go back to your original understanding. Understand the health as dynamic, and similarly understand the disease as dynamic. This paradigm shift Hahnemann already done in his time, and he did in such a way that you can just do it at the bedside. Understand disease by symptoms, give the indicated medicine, and get the result. Patient is going to say thank you, paying your desired fee. You're also happy seeing patients so good and so nice and healthy and very happily paying your fee. So my point is to say that until and unless we try to understand this point of view, what Hahnemann is going to say, we will be in lots of difficulty. There are so many things to discuss further on this. But then I wish that every one of you just first get the topic first in your hand. And while taking the topic in your hand, you must clear your mind first if you have any questions related to this. Are we on the same page? Are we together on the topic? Yes, there is something to be called dynamic. There is something to be called health is dynamic. There is something to call as disease dynamic. If we are all on the same page, then the question comes that how to understand it further. Then one by one we will be breaking all those notions out of us and understand things in a very very clear cut manner. I gave you all the understanding that how this dynamic power has been utilized by the Western medicine to understand their materialistic cause of the disease. We are not to go into too much of all that. I'm saying let us try to understand this dynamic power concept, how to understand this dynamic power in such a way that we are going to be expert in understanding the disease by signs and symptoms and keeping in view the dynamicity of those symptoms. Like for example, we find number of cases, every one of you must have experienced, that patient got a injury in the childhood and on that basis you prescribed. And of course today also there are some symptoms of arnica present, and giving arnica in the indicated potency, that particular disease goes off. That means what? That means what? That this was the dynamic influence of the injury which has been persisting after some 20 years or 25 years. Are we really going to understand this? This is what the dynamic power, the, the understanding of dynamic power is. But if you take and talk all this to the Western school and they listen us and they laugh because their viewpoint is quite materialistic. What is this you're talking that this tumor occurred because of the 25 years back injury to the head? That is why he got this brain tumor. What nonsense. But then, yes, when you prescribe, seeing the indications of the arnica even now, and you give the right potency to the patient, and that tumor vanishes. This is the understanding of dynamic power. When you give arnica, that reduced dose, which is not really bothering anything to be called as Avogadro number. It is way beyond Avogadro number as impounded in the chemistry. Avogadro gave its concept in the time of Hahnemann only, somewhere 1835 somewhere. And I understand Hahnemann did not mention anything about Avogadro. But when he was somewhere contemporary of Hahnemann, and the way Hahnemann was sitting somewhere those days in the Paris, I'm pretty sure that he would have been knowing about him. About him means about his discovery of this Avogadro number. But when Hahnemann saw the results of the very, very highly potentized medicines, means of ultra diluted medicines, which is way beyond his Avogadro number, so-called Avogadro number. He did not bother his discovery at all. This is the paradigm shift to understand the yes. This is the dynamic understanding which we need to understand by Aphorism 11. And when we are going to read the footnote of it, we will be able to understand yes, this is the dynamic power. Even so much so that after really doing so many number of cases, sometimes homeopathic doctors still don't believe their potencies. Can it happen? We are told, since you are unable to teach, since you are unable to show in the laboratory how, we will say it is nothing. We will say it is placebo. It is their problem. My conviction, I have seen numerous cases. I'm sure those who are practicing so thoroughly for even more than the years I am practicing. Let us have this conviction, yes, it is there. Someday, some scientist will find out. Somehow, this Dr. Ramesh Bellari of IIT Bombay, he proved that our medicine has got physiochemical basis. He has proved. So far, it was not proved. He proved, yes, we have a physiochemical basis. Now, we do not know how this ultra diluted medicine connect with us, connect with our nervous system and cause the reactions. Yes, all right, tumor has gone, but show us how. Otherwise, we will take it by chance. We will say it is placebo effect. That is what the mockery they make of our understanding. Despite when, as such, hardly any result in tumor or cancer with them, even for simple allergies, hardly they have result. Because they prove their failures scientifically, as they call it scientifically. So this is all the understanding to keep in mind that they are also using the dynamic powers, but for understanding the materialistic cause of the disease. We have to understand dynamic power. I gave you the example of arnica, that long back injury and patient become all right giving arnica. We have to understand this. This is the whole idea regarding this aphorism. It is not over. This aphorism is not over. It is just a beginning, just an understanding about this aphorism. We will be going into the two footnotes of it. One footnote is just two words, materia pickens. And then there's quite a lengthy footnote to this aphorism, which Hahnemann has introduced in 6th edition of the Agrawal. Here he is going to give us the understanding about this dynamic influence, about this dynamic power. I wish what exactly we are going to understand, if you really want to see it, before really going into the discussion of the aphorism 11 footnote, I wish go to the table of contents and see what is he writing regarding the aphorism 11 and the footnote of the 11. In the 11 table of contents, he says, in disease, the vital force only is primarily morbidly deranged and expresses its sufferings, the internal change, by abnormal sensations and functions of the organism. This is the aphorism which we discussed. And what this footnote says, it is unnecessary for the cure to know how the vital force produces the symptoms. It is the gist he has given here. It is the just summary, just a very, very small understanding about this aphorism and the footnote. We will be going to understand this footnote in detail first. And we will try that, are we able to match with the understanding what Hahnemann is saying. will catch up tomorrow to really understand it further. And I'm saying again to every one of you, lastly, that please come out of your old notions. And what is the way of coming out? The only way is to pour out your questions, clarify your minds. Once you clarify it, the understanding, which is very very basic for us to understand, we will be into the paradigm shift to understand the disease in the patient, and just by the symptoms only, and we will be able to give that salutary relief to the patient which he is seeking, going hospital to hospital, doctor to doctor, systems to systems. Nowadays, every holistic doctor, including me, is feeling very, very segregated that in the country, homeopathy is not very aggressively taken on board for the treatment of COVID-19. Maybe true, maybe their own reasons for that. But then one thing is very sure, that patients have really taken homeopathy on board. The best thing will be to serve the patients as best as possible, so that patient will only tell that yes, homeopathy is working for this condition also. So far, those who are listening me and very senior to me, they know much better that how and what was the understanding regarding homeopathy among the people. But now, in last 30 years, 40 years, it has been taken to the heart by the patients, by the people. And this is the best time to help with our salutary medicines in a very simple way, to give the relief those who are suffering with any kind of seasonal fever or cold or coryza or whatever may be the seasonal acute conditions. Since we are not going to see their test in today's parameter, we cannot name it. Never bother about name. Help the patient. He will be all right. He will keep in mind homeopathy for years together, because take my words, such diseases will keep coming. Such diseases has got not never a single wave. They have 2, 3 waves. Already WHO saying the second wave can come and kill much more people in the world. It is earlier also, the Spanish flu and all such pandemics. Homeopathy was at its best, helped many people. And here also, we all can really help them very well. Mind it, take it as a dynamic concept of illness, understand them at bedside, know them by symptoms. Don't get influenced by the list of the symptoms taken by our learned colleagues of the other side. Do your own case checking. Believe in your senses and the training and the knowing of your homeopathic mitra medica and homeopathic philosophy and laws and principles. Note down those symptoms, find out what is the indicated medicine, give boldly, and he will be all right. I'm seeing such patients. Patients are responding so well. I'm not saying it is COVID-19. I'm saying it is some kind of fever which are having such symptoms. Maybe it is this. But then my patient is doing so well in just 2 days, 3 days medicine. I'm so happy. And I'm sure you all are also doing so. And please do it with this concept. And I'm sure you will have a grand success. And it will not be a grand success of one doctor. It will be a grand success for homeopathy. So everyone, keep understanding this. Keep doing the functioning like this. And I'm sure that you are going to be a great success and a applause for homeopathy. So I think as such, not much of the comments or not much of the questions regarding today's session. So I believe again one more hour is devoted towards the understanding of this. I was telling you, and I'm really very slow in understanding this because much more we understand this area, things will be easier, much easier. And then even understanding Mathematica is going to be very easy. So thank you very much, everyone. And I just wait another minute if anybody is writing any comments or any questions. So I would be like simply uh, going to further explain all these things in much more details. I once again tell you, please read in your physiology the homeostasis. Read it. You will be amazed that how Hahnemann is writing self-preservation. And you will be amazed that how much they have worked a lot to learn this self-preservation. But then their view is all materialistic viewpoint. We will be utilizing that very knowledge for the purpose of the dynamic understanding of the health, disease, and the cure. Thank you very much, everyone. Sign off for today. Catch up tomorrow with some more good knowledge. Thank you.